Support for the podcast comes from the Social Enrichment Center in Media, Pennsylvania. The SEC was founded to support individuals, families, schools, and community organizations. Their objective is to build the self-confidence and social connectedness of children, adolescents, and young adults. SEC provides direct care to young people, utilizing evidence-based therapeutic and instructional strategies. Their team equips caregivers with developmentally appropriate skills and strategies to build each client's social competencies. In addition to socially and behaviorally focused dyads and group therapies, they offer individual psychotherapy, individual social skills therapy, as well as several related services on site, at schools, and in the home. Therapy sessions are available in group or individual format for clients ages 2 to 25. They're contracted with a speech and language pathologist and an occupational therapist who provide these services on site. Learn more about the Social Enrichment Center at socialenrichmentcenter.com. Hello and welcome back to Parenting Stuff I Wish I Knew Sooner and Want You to Know Now. I'm your host, Erica Desper, founder of the Center for Confident Parenting, and a mom who seemed to learn everything I needed to know just the hardest way possible. Today, my guest is Dr. Funke Afolabi-Brown. You're going to correct me if I got that wrong. A triple board certified sleep medicine physician who's passionate about helping people discover sleep as their superpower. I love that. She's been in practice for almost 2 decades and is a mom of 2 kids, ages 12 and 15, who themselves struggled with sleep issues. So she fully understands the impact of sleep deprivation on our health, mental, physical, and emotional. And as a result, Dr. Funke has dedicated her career to helping others optimize their sleep. Thank you for joining me. I'm so excited.
Thank you so much for having me, Erica. You said it all very right. You pronounced my name perfectly. Good job.
I was so confident, and then when it was time to do it, I was like, "Wait a minute, I'm gonna mess this up." All right. Well, thank you so much for coming. First things first, tell our listeners, our watchers, a little bit about yourself, your family, the struggles your children had with sleep. Like, why are you passionate about this?
Yeah, so, I had sleep issues too, right from my training, my entire experience in medical school and even my, subspecialty training. I was exhausted. I was sleep deprived. I had my kids during training too. So I would go to work and then pick up my second shift once I get home, right? So it was just I was on all the time. And I think that just really affected me mentally, emotionally, physically till I hit a wall. And so one of the things I felt overwhelmed with all the changes I needed to make, right? Set boundaries, prioritize sleep, eat healthy, exercise, like all the things. And so
it almost feels easier to just keep hitting your wall.
Exactly. It was like the wall's easier, right? So I think one small change I made to start was sleep, and it really literally helped everything else align. And so I think really seeing how powerful that's changed. I mean, it sounds like small. It's not small. Intentionally saying I'm going to make sleep a priority is not a small feat, especially when everything else is working against that decision. But I think after I realized that, then, things just started to work easier, not necessarily easier like overnight, but I was intentional about the other decisions I made. And then my kids showed up and, they didn't know what I had gone through. And so their own sleep struggles also really further helped me understand how much poor sleep impacts our health. And so after I, got through that hump, it was almost like, okay, I've seen something I can't unsee. And so that really helped me, start to develop that passion. And then I pursued training for sleep medicine. It's an additional fellowship. And then I just realized that's what I love. This is what I was made to do, right? It's usually, I'm sure you know that as well, Erica, with your story, right? Some of the experiences we have had as humans is what then helps us discover what we feel is our mission and our purpose. And it was the same for me. And, even though I am a pediatrician, I'm a pulmonologist, I'm also a sleep medicine physician. I've just kind of said, you know what, I'm going to make sleep a thing for other people too, right? So, yeah.
I love it. I love it so much. And I love what you said about small. It's so easy to feel overwhelmed. So obviously I'm usually coaching the parents to make changes with the children. And that overwhelm is really common of like, all right, there's 7 things, we need to
Yeah.
focus on moving dinner earlier and streamlining our routine. And it can just feel so overwhelming. But I think parents and humans should know that we can make a very tiny change
Yeah.
and see a really, really big benefit in terms of sleep. So don't try to avoid the overwhelm. You may still be able to reach your sleep goals. And yes, I definitely relate to our whatever the good that comes out of our own struggles is that we become very passionate about supporting other people through those struggles. And there aren't a lot of physicians that I know that are super informed about sleep unless they have gone on to study it specifically. And it's complicated. Sometimes parents are like, this kind of seems like rocket science. And like, it's not technically, but it can feel like that sometimes. It's something that it should just happen, right? Like breastfeeding. Oh, breastfeeding is so natural. It's going to go so easily. And that's not the experience that a lot of us have. Like, why isn't it just working? So sleep is complicated too. So I want to dig into some specifics definitely today, but first let's back our lens up really far. Like if we're talking about ideal sleep, adequate sleep, what sufficient sleep, whatever word we want to use, what I know you can only speak generally. What does that look like for children and parents? And I don't necessarily mean that you throw out numbers, but like, what are you looking for to screen, or what can parents look for to screen? Like, is what we're getting enough, both in terms of the quantity and the quality? Because it's another thing I tell families, like there's 2 aspects of it, right? We need to get enough in total, and we need to go through the typical cycles when we're in it so that we're refreshed and restored. So how do we know?
Yeah, great question. So really, like you said, I mean, we're looking at the quantity. So of course that varies by age. And I think that's an important place to start, because if you have a 2-year-old, the expectation of your 2-year-old sleep is going to be different from when they become school age. So it's really important we know that. But then we also have to realize that the range is so wide, right? So school age children, for instance, anywhere from 9 to 11. So, if you're comparing yourself with your neighbor whose child is getting 11 hours, you may start to feel your child has sleep issues, right? Which mean they may not necessarily
Maybe
have
they
that.
don't.
And then the quality is so important. That's what you're alluding to, right? If you have a child who is hyperactive during the day, they're difficult to wake in the morning, they may be sleepy. Many times I tend to see the opposite, which is hyperactivity. They may have a lot of behavioral issues or frequent tantrums. If it's an adolescent, they may be more moody, just more irritable. So those are a few things. And then they may start to have challenges in school with focus and attention and things like that. So, even though this is why sleep is just so fundamental to, the child's learning, the child's behavior, the child's physical development, and actually the child's immune system as well. So you may have disruption in all of this. And I think in addition to the quality and the quantity, another thing I tell parents to focus on is the timing of sleep. Because we all have that circadian rhythm, right? Which for some people, there might be a shift, especially as we get older. We have this period during that period of adolescence where you have sort of a more slightly delayed circadian rhythm or internal clock, which kind of lets your brain know when you should be asleep and when you should be awake. And so having an idea of that timing so that we're not trying to force our 14-year-old who used to go to bed without any problem at 8 p.m. We're not trying to
Oh,
get to them.
I remember those days. They were
Yeah,
so glorious.
I
He would go
know.
to bed
I
and there would
know.
be evening left before I went to bed.
Exactly.
Not the case anymore.
No, no. Now they may be going to bed even a little later than us. And that is
Yep.
physiology. And it's important that we help people understand that too in terms of the timing. And so, yeah, I think I love what you're saying, like looking at it from a very holistic lens, because sometimes we get so caught up with the absolute numbers, but we
Yeah.
have to focus. Like, I honestly will tell you this. I would rather have a child get maybe 8 or 9 hours of high quality, good sleep, restful sleep, than 11 hours of sleep that's just all over the place and disrupted.
Really
So,
fragmented.
really, really important to look at it in that perspective.
Yeah, and of course, we say very similar things to each other. It's good to hear them confirmed
Yeah.
by a triple board certified physician. I always say to parents, like, yeah, let's look at the range of, what we should be falling in, but beyond any number that any of us can throw out there, like, how does your child seem? Like, we know what our kids act like when they're really well rested and well slept, and we know what they're like when they're underslept.
Yep.
I've worked with lots of parents who think they have a really difficult child and, are kind of like grieving that they didn't get the
Mm,
easy kid that somebody else did.
mm,
But a lot of times it's just they're underslept. And like you said, behavioral issues can solely be being underslept. So
mm,
yes, definitely quality, quantity, and timing. Um, when I don't ask this question to terrify parents with research,
mm,
but really just to underscore what you said about the importance of sleep and how it impacts all of our
mm,
areas of health and growing. What is research telling us now or currently about the effects of being underslept on children who still have so much developing and
mm,
learning that needs to happen? We know
mm.
what it's like when we're adults. We get
Yeah,
grumpy and we're not good at
yeah.
getting things done.
Yeah, no, no, such an important place. And like, you're right, it's more of creating that awareness. It's not to make anyone petrified and worried, right? But really knowing that insufficient sleep is something that can impact children in every domain of life. So I talk about from the top all the way to the bottom. So their brain function, learning, development, and also the cognitive aspects of our learning all occurs during sleep. So when we are short on sleep, that is something that we can see take a toll, especially in children, because within the first few years of life, their brains are growing so rapidly. They're forming, making neural connections in a way that's actually pretty dramatic. So when we don't get that occurring, we're going to start to see them either lag behind in learning. We may see them having challenges with executive function. We've actually seen even fine motor skills impacted. And so when I have children that I work with who might be getting therapy, like OT, PT, all that, we're usually saying, okay, we need to work on them from the inside out. If they're not getting good sleep, it's going to be really hard for them to engage and for them to really optimize that therapy they're getting. So that's actually pretty common. And then we also see emotion regulation, really another thing that occurs during sleep, right? So we may start to see that grumpy, again, that really cranky, irritable,
Short
child,
fuse.
short fused, right? Or you may see focus problems. And so that's where the hyperactivity may start to emerge. They seem to be very disruptive. They seem to be very impulsive. And, if you look at the symptoms of ADHD and the symptoms of a sleep deprived child, they're actually very, very similar, which is why even again for children who maybe are on that path of getting diagnosed with ADHD, I usually will say get their sleep checked first. Let's first even figure that out. I'm not saying they don't have ADHD, but it might actually be that sleep is playing a big role. And then we think about even, again, the immune system, and they've looked at this where they've studied folks who had enough sleep and those who didn't. And one thing we've noticed is this: so you may be more susceptible to even the common cold. That's even something that puts us at risk. And you may have noticed it even with yourself, where if you've had like a period of time where you didn't sleep well, you probably might feel
Get
more
sick.
sick. All you need is a child to
Yeah.
just sneeze on you, and all of
And
a
right
sudden,
now, I don't know when this will air, but we're
yeah,
recording it in the dead of February, and
hmm,
every family I'm
yeah,
working with right now,
yeah,
everyone is sick,
yeah,
and they're just passing it back and forth. So
exactly.
if you want to
Hmm.
survive the winter, you've got to
You
get your good
gotta,
sleep, get
yep,
your immune system up.
yep, yep.
Yeah, that's really important. And I think a lot of people think that sleep is just this downtime,
Hmm.
and parts of it you're
Yeah,
like in a coma practically,
yeah,
right?
yeah.
But there's a lot more time spent
Mm-hmm.
in sleep where work is being
Yep,
done
yep,
internally, and that's really important
yep,
for parents to understand.
yep.
um, Awesome. Now what about potential effects for parents
Hmm.
who aren't getting sufficient sleep? I mean, I know all the same applies, but is there anything else you want to say
Yeah,
to them?
yeah, no. So family dynamics is a big one that's impacted, right? Now you have a child who's irritable because they're not sleeping. It's causing a lot of stress in the family. It can impact their relationships. And they've actually looked at work productivity of
Yeah.
parents who have children with sleep issues, and I've seen that it's lower. I mean, just even anecdotally from my experience and from my practice, I've seen parents just either change jobs or switch from, being able to work outside of the home to staying home to work because, the child's sleep was impacting them so significantly. There is increased risk of mood disorders, anxiety, depression. Again, family relationships, intimacy with the spouse, all those things can be affected. Now, when parents are not sleeping well, then we start to get into the consequences of sleep deprivation, even on their physical health as well. So increased risk of hypertension, diabetes, obesity, right? So all those things now then start to come to play. Because if you think about it, you're not well slept, your child is not well slept, you as well are not well slept. So, and then we start to see those impacts as well in the families.
And you mentioned hitting a wall.
Mm.
So I'd love to take just one moment to say to anyone, there's this common mantra of like, I'll sleep when I'm dead,
Mm.
right? And Elon Musk hasn't done much for for
Yeah,
improving,
exactly.
for promoting sleep. But it's important to note, like, that's not a thing, right? Like, my
Mm.
response to that would be, well, that may be sooner than you think, or sooner than
Mm-hmm.
you planned. Like, we
Mm.
will all eventually hit a wall of burnout or breakdown,
Mm.
or something. Like, it's not sustainable if a parent is saying to themselves, like, I'll just, whatever, I'll martyr myself
Yeah.
and I'll just deal with it. What would you say to that parent?
I would say first of all, it depends on what that wall feels like. It may be mental health crisis.
Mm-hmm.
Unfortunately, there are studies that have shown increased risk of suicidality
Mm.
from chronic sleep deprivation,
Right.
increased risk of cancers, right?
Because
Some
it
of
really
this,
starts to affect every
yeah,
cell,
it
literally every
does.
cell in our
It
body.
does. Heart attacks. So, again, not to scare you, but these are things that will take us down into the grave much faster. So, we don't want to wait to take care of ourselves, to take care of our sleep health until that happens.
I think
So,
that's so important because we just
yeah,
put ourselves at the bottom of the list, if we're
yeah,
even on the list. But this is
no,
really like a matter, it could be a matter
yeah,
of life and death, not
yeah,
just whether we're like surviving versus thriving.
yeah, yeah. So true. So true.
Yeah, very, very true. All right. So keep that in mind, parents. So when sleep is not ideal in quantity, quality, timing, what have you, if it's a battle, a struggle, what are you seeing most often in the patients that come to you as being the underlying causes, the common ones?
Yeah, yeah. So, behavioral is a big one. So
Mhm.
probably I would say almost 40 to 50% of my practice still with behavioral issues.
Which is also good for parents to know.
Yeah,
It's not always
yeah,
a medical thing.
yeah, 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 yeah. Sometimes it's a medical sleep disorder, right? So it could be sleep apnea, which actually is much more common than we think. So your child snoring and having restless sleep, maybe an underlying sleep disorder like sleep apnea. It could be restless leg syndrome, especially with kids who are maybe picky eaters. They may be low on iron, and low iron stores have been associated with just that constant tossing and turning. And what that ends up doing is it fragments your sleep, and so you're waking up still exhausted, or your child is waking up tired. It could be other things like, narcolepsy, especially if they're older and maybe they're getting enough sleep, but they're still so sleepy, or they're having some other weird symptoms, which is something we need to be aware of. And then I may see, especially for children who might have autism or ADHD, may just be sleep issues specifically related to that underlying condition. And then I would say a lot of kids that have other medical issues, so a child that has asthma or a baby that has reflux
Yeah.
or something of that sort, they actually may present with sleep issues. And so it's when we're now delving in to say, wait, what is going on at bedtime? What medicine did you say your child is on? And then we realize, okay, this is what's going on. And sometimes it may be because of medication. So maybe a child who was put on medicine for ADHD, and it's perfect. It's keeping them
But it's
focused
a
during the
stimulant.
day. But it's a stimulant. So in that situation, we're working really closely with their prescribing doc, really closely with their psychologist to make sure that they're on medications that are safe or that we adjust the timing.
If a parent is concerned that there's
Mm.
an underlying medical issue, and we get this a lot, our team will say, like, here's why this is happening, here's what we're going to do to change it. And they're like, I hear you. I hear you that it's
Mm.
behavioral, but I'm really worried there's something wrong with my kid,
Mm.
right? It can't just be
Mm.
that. So lots of parents share that concern. Obviously, they'd bring that concern probably to the pediatrician, but if they are brushed off by their pediatrician, which I also hear a lot,
Mm.
regardless of what type of concern it is, maybe they're of a wait and see mentality, or they think like, oh, you're just a first time parent and you're very nervous. What would you suggest to a parent whose gut is sort of telling them something's up, that their main doctor isn't as concerned.
That is just so heartbreaking, but it's unfortunately common. I think go with your gut. This is one thing I say, mama knows best. Listen, there are things my mom told me and I'm still like, oh, mom was right, right? Unfortunately, she's passed on now, but mama knows
Sure.
best. Go with your gut. You are that child's advocate. Nobody else knows that child like you do, right? Nobody else is spending the night up watching them either struggle with breathing, tossing and turning, looking like they're fighting something. You're the one. So I want you to really take that space and just take it fully and advocate and ask for help. And if you don't, the beautiful thing now is there's so many resources online, which you have to be careful about, of course. And
Sure.
so finding the right tools, navigating that, asking for help. There are sometimes when you can request a referral to see a sleep specialist or a behavioral consultant or a sleep
Right.
coach.
There
Just, you
won't
don't
be
even
any
need.
harm in having someone take a peek
And
just to put my
exactly,
mind at ease.
and if all they say is yes, you're right, nothing is wrong, then at least you explored that fully. You never want to get to the point where you're like, oh, I wish, and so I don't want you to live in regret. There's no better time to do that than now. And so yeah, I think just keep advocating for your child. They deserve that.
Wonderful. I did want to go back to one thing. So another thing we see often is kids that were great sleepers for maybe the first several years, and then all of a sudden they're having trouble, and it has to do with the you can explain it better, but the tonsils and adenoids, whatever, enlarging. Um, how can parents have that on their radar? They've always
Yeah.
had a great sleeper, and all of a sudden it's a problem.
Good question. So there's a peak age where those adenoids are just these tissues at the back of your nose. We call them lymphoid tissues, so they help filter out like germs. But as your child is growing, usually anywhere from about maybe like 18 months to about 7 years, they go through this peak growth where everything's just growing so fast. The tonsils are behind the throat. They're these little balls of tissue at the back. And so that grows very rapidly around that time. So if you have a child who has snoring or restless sleep, who has maybe daytime issues, who maybe they wake up and their mouth is super dry, or they're really hard to wake up in the morning, or they're having pauses in their breathing. If you have any one of those symptoms at all, that might be a sign that they have sleep apnea, okay? And what we need to do with that is we first need to diagnose it. And the way we do that is we could get a sleep study. A sleep study is a test
That was going
where
to be my next question. I know, sorry to interrupt you. I know that when we
no,
say that, parents are like, oh my
yeah,
God,
yeah,
very intimidating. So, yes, please go on. Like, what's involved?
yeah.
Is there a smaller intervention that can happen first?
Great question. Great question. See, we're like on the
We are.
same. I love it. I love it.
We're
So
like the same person, only
I
you're
know.
far more highly educated
Oh,
and
please.
experienced.
So a sleep study is a non-invasive test, and really what we're watching is what is going on with your child's breathing, what is going on with your child's movement, what is going on with your child's brain while they're sleeping. And so there are multiple stickers. Some stickers go on the head. Some stickers, there's a nasal cannula that just measures to see if there's any obstruction. Remember, we said obstructive sleep apnea. So we want to see, is this child having pauses in their breathing because there's an obstruction because of those tonsils, adenoids, or other tissues that are in the way? We also check, chest movement. Are they actually moving their chest to breathe? We check oxygen levels, and then we do some other tests just to really make sure that what you're seeing really actually matches up with data, right? Because before we expose our child, the treatment of sleep apnea is usually surgery, either surgery or, dental interventions or things like that, or some medications in some situations. Before we expose them to those kind of strategies, we want to have data like, is this actually something that is going on with my child? Or is it just snoring? Because some kids just snore and there's nothing else going on.
Right.
So that helps us to know exactly what. Nothing hurts. They usually will come to a sleep lab or a sleep center, which may be part of a hospital or could be freestanding. And we get that test. So they come overnight. And so after the night study, you and your child will go home, and then the study gets interpreted by a sleep physician like myself. And then we can then talk about what are the different treatment options, which will depend on the severity. The severity is categorized into mild, moderate, or severe. So that really sheds a lot of light into what exactly we need to do and how active or how fast we need to innovate. Now, there is an alternative, which are home sleep tests. Now, a lot of research has been done for home sleep tests in adults. In children, the work is still sort of ongoing. I think within the next couple of years, we'll really be able to do this in certain children. But for most situations, you may need to do the in-lab test. In my practice, we do offer home sleep tests. I use it more of a screener, exactly like what you said. What can we do? Do we need to move forward? Do we not? And I think it sheds so much information. And sometimes I'm able to make that diagnosis based on the home sleep test. But overall, the American Academy of Sleep Medicine is really working actively on getting the evidence behind using this tests at home.
Awesome. It's good to know there is that option if parents
Yep.
want to start small.
Yep.
And great to know that other than being in a novel setting for the night, it's not a super invasive. Even if you have to
Exactly.
go to a lab, it's not that invasive.
Mm.
All right. So those are sort of the medical reasons. You said, I think 40-ish, 50-ish% of the families you work with, it does boil down to being what we'd call behavioral. Um, I think 90% of who I see, that's probably the case. And by behavior, when I say that, I typically mean the routine leading up to sleep, the environment they sleep in, how they fall asleep, how much help they have, or how dependent is it, what habits are in place, and do they have the moves to put themselves to sleep and back to sleep? Can they go through the motions? Does that match what you mean when you say behavioral? Same kinds of things?
Yes. So so the way the diagnosis is within our sort of sleep medicine world, we have this whole broad category of insomnia. And insomnia is difficulties either falling asleep, like you said, like child has difficulty falling asleep, staying asleep, or they're waking up earlier than usual. For children, we have a category under that insomnia umbrella called behavioral insomnia of childhood, which is exactly what you talk about, and it sounds like you work with the patients on. Then we also have other categories, which can be insomnia that's due to what we call psychophysiologic insomnia. So we see that in teenagers, we may see it in children who are anxiety prone. They just have a hard time shutting their mind off. So this would be a child who says, well, or the parents is like, well, I put them in bed. They're able to stay in bed, but they can't shut their minds off. It's
Right.
similar to what adults experience, but
They
this
don't want
really,
anything from their parents, but they
yeah,
can't
they
bring
just,
sleep on.
they can. So that's one. Another one we see, we call it insomnia due to an underlying, usually we'll call it like medical or mental disorder. So again, children with autism, children with ADHD, children within that spectrum, neurodiverse populations, about close to 70%, if not more, have some kind of sleep issue or the other. So they're not fully behavioral. They're not fully psychophysiologic. They're somewhere in between. And so we
Right.
need to, we sort of approach it from a different lens because families are like, well, I don't know what else to do, And so really looking
Right.
at it in those situations, sometimes it may lend itself to some medication in addition to the behavioral sleep issues, right? So really tailoring it to what the children need. But those are the broad categories of the insomnia umbrella.
Okay, wonderful. That was actually, I didn't know any of that, so thank you. But it makes perfect sense.
Yeah.
So let's say that now let's bring our lens really tight. Let's say that this is just, a toddler, 2-year-old, a baby that just like, I want it to happen this way. I want it to happen in your arms. And if it isn't going to happen in your arms, I'm going to let you know that I wasn't expecting that and I'm not happy about it. We don't have to dig in today to the strategies that, would address that. But what I do want to ask about that is when a parent decides for whatever reason they're depleted, we need to make a change and my child's not happy about it, there is often some complaining / crying / fussing, boundary testing that goes on. And of course, parents are very concerned, and rightfully so, that powering through that with any strategy, whether it's hands on, hands off, in between, uh, the effects of that may be traumatic. I hear that word tossed around a lot. It might change their brain. There's a lot of scary information when you look up crying on the internet. It might negatively impact the bond that they have, especially if the child's pretty young. So I know that those concerns are a huge barrier for either one or both of the parents that are supposed to be implementing this change. Um, I know a good amount of that research because I had to sort of make peace with it myself for my son, but mine's probably outdated. Is there anything current or not even current that speaks to that? I'll
Mm.
just leave the question there.
Yeah, yeah, great. I mean, so a lot of concern was initially voiced when we really started to push this kind of various interventions, which is really helping your child develop independence at bedtime. And there being what we call meta-analysis. So these are studies of large studies. So they literally took all the big studies and reviewed them, and consistently across board, when children can sleep better, their mental health actually improves, and this is sustained, and the parents' mental health improves. And they looked at this in relation to parent-child interactions down the line, and really there's been no studies that support that there's going to be some kind of downstream effect. So your child learning and maybe going through a little bit of discomfort around being able to sleep on their own down the line is not going to be the cause of why they are in a therapist chair. Let's just put it that way.
Right.
We have
First
the
of all,
study.
all of our kids are going to end up in a therapist chair.
Oh my God. Oh my God. No, yeah. So that's really, really something that we've not been able to, we've not seen that. So that's good. And I think that really does support that the work we're doing and the benefits in terms of parents' quality of life, family dynamics, those things have been shown to establish, to be better.
I think that's really important for parents to
Yeah.
hear. And just to clarify, there's not only a lack of evidence that there's a negative in
Mm.
the downstream, there is evidence that
It is
there's a lot of
positive. Mm-hmm.
positive in the
Mm-hmm.
downstream. Because it's one thing to say like, oh, it won't, won't hurt anything, but the benefits,
Yeah.
offset that even. Um, yeah, I think, and I always tell parents, I mean, you know a whole lot more about child development and brain
Mm.
development than I do, but I say like, your child is going to experience that. Let's say it's
Mm.
the bedtime spot. That's
Mm.
one spot in a
Mm.
24-hour day and one day out of a
Mm.
week, and just go on from there. Like, they're still going to have their needs met. They're
Mm-hmm.
still gonna, come to you if they fall down and bump their head.
Yeah.
They're still gonna take it in within the context of their
Mm.
whole life experience. And it's just so important to say that not all stress
Mm.
is harmful,
Mm.
right? There's a kind
Mm-hmm.
of stress like, what if I was stressed about doing this,
Yeah.
for the first time, but I got through it and now I'm doing it all the time, and it's okay. It's like a
Yeah.
learning stress. I can
Exactly.
cope with things. And that's an important distinction, I think, for parents. It's definitely a different type of stress. Um, okay, so that all was super helpful. There's a million more questions I want to ask you with your doctor hat on, but take that one off for a moment.
Mm.
Put only your mom hat on, because you are a mom of two. One is a teenager, one is about to be, which is such a fun stage. So only with that hat on, when you first became a parent, so say 15
Mm.
years ago, what did you find most challenging in that early stage?
Well, apart from sleep, um,
That was it.
I think it was really, honestly, it was asking for help
Oh,
because I had been superwoman all the while, right? I had grown up in a culture where it was like you suck it up, get it done, or nothing, right? So really becoming vulnerable enough to say, hey, I can't do this alone, I need help, was something that I think was challenging because it meant I needed to be vulnerable. And sometimes as women, as high achieving women, that's a hard spot to be. So I would say that was a big one for me.
absolutely. Because we're not meant to do this without help.
Mm-mm. Mm-mm.
That's sort of a construct
Mm.
of our current
Yep.
culture, and the culture here in the States.
Yep.
But in other places, you have a literal village of
Mm.
people that can help you with this
Yep.
new little person.
Mm-hmm.
Um, yeah. All right. And in those early days, what did you find? What brought you the most joy about parenting? So you weren't sleeping and you had no help and you couldn't accept help. What did you find joyful?
I think it was regardless of how much I screwed up, they still
Mm.
loved me. There was still that unconditional love, right? It doesn't like, what do they know? Like, my child is not upset with me that I left him in a dirty diaper for hours. Like, no, they still do. And just seeing that through their eyes makes it all worth it.
Yeah, yeah, the unconditional love. We've had
Mm.
others who have said that as their
Mm.
biggest joy as well. You just
Mm.
don't really understand. You can't really understand it
Mm-mm.
until or unless you experience it. And kids
Mm.
are really, really great at that.
Mm-hmm.
Um, All right. Finally, what is one thing that you have learned on your own parenting journey that we have not touched on yet that you wish you knew sooner in it and you would want other parents to know right now?
I would say perfection is not needed at
Mhm.
all. It's messy. And your children will teach you what they need from you, right? They will. And every child is so different. So I have two kids, and at some point I was wondering why one was so different from the other. And that's the beauty of it, because then they teach me what they need, and I'm able to adopt, I'm able to pivot, and really just enjoy the journey in spite of all of that. Yeah.
Yeah, it's amazing. It solves the nurture nature
Yeah. Yeah.
debate, right?
Yeah. Yep. Yep.
Wonderful. That was awesome. I'm sure I will have you back again because I feel like we could dig into any of these things so much more. But I want to keep you on time today. Thank you so much for joining me, parents, listeners, watchers. I'll be back soon with more stuff that I and others wish that we knew sooner. In the meantime, I'll leave you with an updated list of stuff that I've learned the hardest way. They've heard my original list enough times. It does talk about asking for help when you need it,
Mm,
and accepting it when it's offered. But this is the new list, and it is your to do list will always be there.
mm,
Please put yourself on it. You
mm,
can't pour from an empty cup, so schedule ways to refill yours every day, especially with adequate sleep. And
mm.
three, there is no way to be a perfect parent, countless ways to be a really good one. So I'll leave you guys with that, and we will be back soon. Thanks for listening and watching.